Sabrina, Jason, a group of healthcare professionals are making a concerted effort to have the governor reconsider his nomination of Dr. Sam Friedman to the Guam Board of Medical Examiners. During a meeting last night, a group of doctors and nurses agreed to ask the board to investigate Friedman's comments.
Request the Medical Licensure Board to investigate Dr. Friedman for unprofessional, unethical behavior that has disrupted medical care on Guam, has caused unnecessary fear among our patients.
And with a show of hands, members of the island's healthcare community agreed to endorse a written complaint to the Guam Board of Medical Examiners against the governor's nominee to that very board, Dr. Sam Friedman. Current GBME co-chair Dr. Patrick Santos.
The GBME will investigate, see if it's true, if the allegations are true or not. And the whole idea is not to take away his license. It might be a reprimand, a letter of warning.
But FHP oncologist Dr. Arnold Wax believes Friedman did much more than acted unprofessionally or unethically.
He actually violated a federal law. He took an undiscoverable issue, which is a hospital record, and made it public record. That is a violation of the 1986 COBRA law, also, which is a peer review law and which is a discovery law.
On Friday, Dr. Friedman told lawmakers that patients were dying needlessly at the Guam Memorial Hospital and there was a lack of adequate review of these cases. He specifically mentioned the death of a 41-year-old pregnant woman. Friedman said her death could have been prevented had she been properly diagnosed during her pregnancy. But hospital OBGYN Dr. Jeffrey Gable and another OBGYN physician claim Friedman doesn't have all the facts.
I don't think that going after that kind of behavior is a witch hunt. I think that's the way it should be. I don't think this is anything that we wouldn't do to anybody that recklessly goes around violating the laws and the ethical rules of normal practice of medicine. I think this is despicable.
When there is a case that has some political overtones or falls out, we send this case off island for an independent review. In addition, when there is something that goes awry, we take corrective action. That is a fact, and you can't quote me. And lastly, I want to say, without reservation, GMH is a very safe place to have your child.
Friedman has said that if given the clearance from the hospital, he would provide specific details to prove his claims. He feels those who are most threatened by the change he hopes to see in Guam's medical community are the very ones who are crying the loudest. Today, he told KUAM, it is obvious by some physicians' comments that some of the medical community believe the GBME is there to stifle opposing views and free speech. While the outgoing GBME may have seen itself in this role, hopefully Governor Calvo has broken that mold and will put in a GBME whose primary responsibility is to the patients of Guam and the assurance of competent medical care. And while the decision on the governor's nominee ultimately rests with members of the legislature, it's clear the medical community isn't happy about having their so-called dirty laundry aired out in the public. Dr. Chris Dombrowski.
There's an internal way to deal with these things, but not through the media.
And Dr. John Garrido urged his colleagues to collectively work to undo the damage he says has already been done.
That GMH is not a place where we kill people. This is a place where we heal people. So we need to improve our image.
Guam Medical Association President Dr. Tom Shea told those present at last night's meeting that there will be another follow-up meeting, as he says they will not let this issue go.